Hello, we're here to talk to you today about parenting a child with juvenile arthritis and understanding the many challenges and decisions that you will be facing on this journey. Presented by, I am Danielle, author of My 10-Year-Old is an Old Lady That Turns Purple.
And I am Stacey, author of World Autoimmune. Juvenile arthritis is a disease in which the body attacks itself. It mistakenly views other cells, healthy cells, as unhealthy and attacks them. The result is severe inflammation. It can occur in any part of the body, the joints, the eyes, connective tissue, organs including the heart, liver, lungs, basically any part of your body can become under attack.
With joint pain, any joint, including the jaw, the tailbone area, and even the rib cage, called costochondritis, can be affected. The costochondritis feels like a heart attack. Others may not always be associated with autoimmune arthritis. In fact, jaw is often silent. It doesn't hurt until it's really bad. Watch for unexplained injuries, mystery sprains, especially if it seems to be the same area all the time. Swelling, redness, possible heat around the joint, although you won't always see redness, and possibly you could have little nodules, little bumps popping up on the joints.
Children with the systemic form of the disease, spike fevers usually at the end of the day or at night. There are rashes all over their body. Most children with juvenile arthritis do have extreme fatigue. It's very hard for them to keep going, take naps frequently during the day. One of the things that are really important to look for is the eye disease uveitis. There's not always symptoms for it, so watch for squinting and the child complaining of eye pain. One of the big issues with Jordan, my daughter, was she was very moody when she didn't feel well. And it just came out of nowhere. She'd be happy playing, and then all of a sudden it was like a switch. Something in her just changed, and she just went from this perfect little angel into this just monster, basically. A lot of times the kids will not want to do things that they, used to enjoy, whether that be, climbing on playground equipment, going upstairs. They'll fight to not do something that causes them pain.
My daughter, actually, they thought she was autistic. Her response to the pain was trying to control everything that she could control. Her anxieties were sky high. She was obsessive about things, like she had to have 3 blankets on in the exact same order every night or she couldn't sleep. She'd just scream. There were a lot of little things that she would try to control that we didn't realize. Many pediatricians don't think about arthritis in children, even though more children in the U.S. at least are diagnosed with arthritis than diabetes, sickle cell anemia, and cystic fibrosis combined. Don't think that you're crazy. Often doctors don't quite see it. Arthritis is often confused for growing pains, and parents are told that they're just worrying too much. Once your doctor suspects arthritis, ask them for a referral to a pediatric rheumatologist. You may have to drive a long way to get there. There is a huge crisis, a huge shortage of pediatric rheumatologists, but they are not the same as taking your child to a regular rheumatologist. Regular rheumatologists see adults, and the treatment for adults and even the diseases for adults are different than they are for children. And if you chart symptoms so that you have an idea of what is happening, that will help the doctors to understand. And take pictures. Take pictures of anything weird that you see, any redness, any swelling. That will really help. You cannot deny photographic evidence. There's no single test to diagnose juvenile arthritis. The diagnosis is based on multiple factors, including blood tests, physical exams, and sometimes x-rays and MRIs. X-rays can show previous damage, but they can't show current inflammation. MRIs can show both, but they're expensive and often your insurance will override that. Blood tests may also be irrelevant. A lot of people, a lot of kids and adults both, don't have any of the factors in their bloodstream, and their inflammation levels don't even show up in blood work for quite some time. But no matter what, try to get copies of every test and save them to a thumb drive, or just keep the copies on file. This way, if you change doctors, you don't have to worry about having to get all your files, and you have everything. And also because you can double check the doctors that way, you might catch something that they don't see, because even though they order the tests, they may not actually be looking. That had happened with us recently, where I should have realized in February that my daughter was anemic, but even though I was asking doctors, nobody seemed to really put two and two together until this last time. And finally, 3 months later, they figured it out. You can be the best advocate.
Care by a pediatric rheumatologist is one of the most important things in dealing with this disease. Danielle had already mentioned, the treatment for children often differs for adults. So getting them to see a board-certified pediatric rheumatologist is so important. The primary goal for treatment in juvenile arthritis is to control the inflammation and swelling in the body, to help relieve the pain and prevent damage to the joints, to the eyes, and to give them a good quality of life. Treatment plans for children include medication, physical activity, physical and occupational therapy, eye care, dental care, and proper nutrition. Those are all very important things. One thing that I cannot stress enough is making sure that your child gets seen by a pediatric ophthalmologist to check for uveitis. Jordan's uveitis showed up about 6 months after her official juvenile arthritis diagnosis, about a year after her onset, where things started happening. She has been fighting uveitis now for about 6.5 years, roughly. At first she was seen every 3 months, and then it showed up, and we were now being seen everywhere from about every 6 to 8 weeks, because she cannot be clear for the time that would be normal for a regular child with juvenile arthritis. Make sure that they dilate their eyes at least 2 to 3 times a year, if not every time. When you dilate the eyes, you'll be able to see toward the back to look for information back in the back of the eye. Children without uveitis should be seen at least twice a year, every 6 months. There are a couple of lab tests that can be done to point to where if uveitis would develop. However, they are not always accurate. Jordan is actually one who does not have the blood markers for it, but she does have chronic uveitis.
Also, uveitis can cause blindness if it's not treated, or if it's not treated aggressively enough, so it's very, very important. As for school, kids can be very cruel, and if they see a difference, they're going to pick on it in some cases. Kids have a hard time with some of their classmates, and especially some of the medications can cause moodiness. Some of the medications can alter personality. Some of the medications can cause drastic changes. My daughter, after starting prednisone because she was on such high doses, gained 35 pounds in a month and a half. She started off so teeny tiny that we couldn't, we tried like anything to get her to gain weight and it wasn't working. And all of a sudden she was this big like balloon. She was just so chock full of water. It was unbelievable. And it was heartbreaking, and people would stare at her and point, and she really had a time. People are cruel, even adults. Catching up after absences can be difficult too. It can be very overwhelming to transition back into the classroom when you've missed a lot, and the kids feel it. They feel they're trying so hard to do well and impress their teachers, and it's hard when they're not there enough. Many kids consider therapists. They go and talk, they have sessions with therapists, and it seems to be a benefit to many. Not all, but many. You can try scheduling reading with the teachers to talk about it. We've taken to sending my daughter to the guidance counselor if she's having a really rough day, and the guidance counselor will sit down and talk to her and kind of help out. I have gone before and stood up in front of the classroom and talked to her classroom about her problems, and I really think that helped a lot. She had an awesome, awesome class last year. And if you're looking for information, look for websites that deal specifically with your child's diagnosis. Be careful what you're looking at because not everything is going to be right. But once you kind of get good at Googling things, you start to find the good websites.
Okay. Be prepared for changes with the disease. A lot of times, what starts out as just knee involvement or wrist or something, it can evolve into a different type of connective tissue disease. Some children stay the same, and others do progress into something else. You never know what's going to happen. Jordan started out with one knee and one toe, and 7.5 years later, she probably has anywhere from 10 to 12 joints involved. Her knees obviously were what started it all, and she has her ankles, her toes, her wrists, her shoulders. You just keep an eye out for other things and, document, bring it up to your rheumatologist's attention. And again, make sure that you get the regular eye exams so that if you do catch the uveitis, it will be treated right away.
On that note, too, Emily started off with a few joints. I think, honestly, she started off a lot earlier than what was caught, even though we were always at the doctor's office. But she went from just the juvenile arthritis to all of a sudden Raynaud's, which is talked about in the takeaway. Then she had little bits of scleroderma, which I don't think I have discussed, but I believe there's also a takeaway for. Then all of a sudden it was mixed connective tissue disease, and then she developed dermatomyositis on top of that, which is basically severe muscle inflammation and destruction of the muscles as well. We obviously never, ever would have expected that. You just don't know. She's on modified activity because of prednisone, because she's on a steroid. They don't want her jumping. She can't have anything high impact because steroids can cause brittle bones. But most kids can continue on doing whatever sports they want. Treatments are another thing that's very important, and a lot of parents are very weary of taking these medications or putting these medications in the bodies of their children, which we were both as well, but there are studies out now that say that the more aggressively the disease is taken care of in the beginning, the better off the child is, because you don't have as much damage, but also because these really aggressive treatments are knocking the disease into remission. And once you achieve remission, you don't really have to worry as much at that time. There won't be the pain, there won't be the joint destruction. It can come back, but if you can knock it out with aggressive treatment, you're better off than trying one or two things and waiting 6 months to see if they don't work. With the links to our blogs, if there are any questions, please, both of us have comment areas available. You can ask us questions, leave a comment. We'll get back to you. I know mine links to my Facebook. I forget, yours does too, doesn't it, Stacey?
Yes, it does.
Yeah, and you can throw up messages. Also, in the takeaway that I have at the end, like I said, I do have a little blurb on Raynaud's and a couple of other things in there, but I have a ton of links. I dug out some of the better links that I have, and I know it's hard to find places that you trust to get information from. So I put up some good ones that I know that I have gone back to my doctors and verified that they're pretty good.
One of the things that I just want to add before we close is, while this is an extremely serious disease, for the most part, children do have a very happy, healthy life. There are going to be lots of ups and downs, but overall, most of the children with juvenile arthritis, they're perfectly happy. They participate in sports. They do everything a healthy child would do. There are some extreme cases where children cannot do contact sports because of their disease, or because of the high doses of steroids, which can cause them to break bones or have more problems. But overall, these kids are perfect. They have a very happy life, and while they don't like the disease, they do learn to live with it, and they adjust very well.
They're probably stronger than most adults at dealing with things. Especially, it seems like the younger the onset, the easier time they have of dealing, because it's all that they know. They don't really know a life without pain. Also, in some of the takeaways, there should be one on basically school issues. In the United States, we have an IEP, an individual education plan, or a 504, a disability document, that states that basically the doctors state what you have to avoid, and the schools have to follow what they say. I'm not sure of the regulations in other areas, but those are important things to look into, because they could really help save your child a lot. A lot of time, a lot of energy, a lot of struggle. Do you have anything else to add, Stacey?
I believe we've pretty much covered everything.
Cool beans. Well, again, if anybody has any questions or comments, just feel free to look us up.
Thank you.
Thank you for staying through. Take care.